now.
Good afternoon. Thank you for coming. My name is Barbara Spreckman. I'm the Assistant Director at Mercer Council on Alcoholism and Drug Addiction. And I welcome you today to the Healthy Outlooks program, Alternatives to Managing Chronic Pain. Just to let you know, this presentation will be recorded, and it'll probably be a little less than an hour, and I'll open it up to questions and answers at the end of the presentation. Before we get started, just to let you know, I am not a healthcare provider. I am a prevention specialist. So the information that I'll be giving you today is evidence-informed, evidence-based. It's information that I've done research on. However, if you want to take action on any of these different modalities or treatment alternatives, please always consult your healthcare professional before doing that. If you could go to the next slide, please. Mm-hmm. So the purpose of today's presentation is to educate all of you about some of the very harmful effects of prescription drug misuse in the treatment of pain management. As you probably know, we are still in the middle of actually a couple of pandemics or epidemics, one of them being COVID, but also the opioid epidemic. There has been an explosion in the use of opioid pain management prescriptions. Opioids are highly addictive. They're very strong drugs, and they're often prescribed for pain management. We're going to talk today about some of the alternatives for pain management besides using opioids. So the second bullet talks about the proven non-pharmacological means of addressing pain and alternative approaches. I will be talking about those that are often complementary to any medical procedures or advice that you've been following, treatment protocols you've been following right now, to give you some options. And then we're also going to talk about how do I evaluate new treatment approaches to pain management? How do I know that these are legitimate? How do I know that they're not just somebody's idea of how to manage pain? And then by the end of this presentation, you should be able to name at least one possible negative effect of prescription drug misuse, and also at least one proven alternative pain management technique. Next slide, please. So, chronic pain. Okay, what is it? And chronic pain, you know, as we age, our bodies go through many different changes. And even if we don't have a chronic health condition, as an older adult, we often feel more aches and pains than we did in our younger years. I know certainly I have. Pain can be your body's warning system that something's wrong. And it's important to communicate with your doctor where you feel pain, when you feel pain, and how specifically how the pain feels. So there are two kinds of pain. There's acute pain and chronic pain. And acute pain begins suddenly. It lasts for a short amount of time, and it goes away as your body heals. So that might be something like, you know, post-surgery, or a broken bone, or a toothache, or you cut your finger, or a kidney stone. These certainly are painful experiences, but they only last a certain amount of time. But pain that persists for 3 months or longer, and now that's considered chronic pain. And this pain often affects older adults. Many times it's caused by a health condition such as arthritis. I myself have arthritis. It's centered in my hands. And the chronic pain comes and goes. I am able to manage it through medications that are slowing down my rheumatoid arthritis, and occasionally over-the-counter medications, anti-inflammatory medications when I have flare-ups. But chronic pain can sometimes follow acute pain from an injury or surgery or other health conditions that have already been treated. So sometimes even when the body has healed from a acute pain situation, there are situations where chronic pain can develop after this. Living with pain can be really difficult. It can cause lots of problems, getting in the way of your daily activities, disturbing your sleep and your eating habits, making it difficult to continue working, keeping you from spending time with friends and family. And it can be also be related to depression or anxiety. And as we go around this circle, you'll begin to see when we have chronic pain, it almost becomes like a vicious circle where we feel, you know, because of the pain, it may restrict our movement. We might not be able to walk as fast because our knees or our hips, you know, are hurting us. Next, if you could populate the circle, that would be great. Oops, it doesn't want to populate, does it? That's okay. I'll tell you what some of the other things are. It's things like, you know, negative emotions. Because we have the restricted movement, we start to feel bad. Oh, I can't do the things that I used to do. I can't, you know, go bike riding or hiking. And so that may cause us to feel depressed or anxious. And that might impact our sleep. We, you know, might disturb our sleep because we're dwelling on things. You know, this vicious cycle of all of these symptoms repeating themselves over and over again because of the pain that we're facing has to be broken. And there are different ways that we can crack or break this vicious cycle. And one of them is by looking into alternative therapies or complementary therapies that might hold promise for us. You can go to the next slide. So in one course that I teach, we talk a lot about self-management skills because you know, we really have to be informed consumers and also take charge of our own health and our health care. And when we think about our chronic conditions, and we think about how can we problem solve or how can we be solution focused to this pain, it gives us more power to understand that we can take more control than we are taking right now. And I know for me, it actually starts making me feel empowered and actually starts making me feel better. Also, within our control is maintaining a healthy lifestyle that features stress management, regular exercise, healthy eating, and sound sleep habits. This just is common sense. You know, if we're leading, living a healthy lifestyle or working towards that, your body is going to feel better, your mind is going to feel better, your spirit's going to feel better. These are things we should aim towards. Learning how to manage common symptoms. Again, if there are certain flare-ups, knowing what we can do in those situations will, such as, well, for me, taking over-the-counter medications rather than opioids to help me manage my flare-ups is a choice that I've made. And also making decisions about when it's important to seek professional help and what treatments to try. You need to have a open communication with your healthcare provider. Let them know what you're looking for, perhaps what you'd like to try, and give them as much information as possible about your particular pain, because everyone's treatment protocols should be different. We should not be all treated the same way, because our bodies are unique. Again, working with your healthcare team is essential. Using your medication safely and effectively while minimizing the side effects. We're going to be talking about that as well. And finding and using community resources. What's fascinating to me is there are so many resources out there that go untapped. Now, I don't know how many of you are into social media, but there are, if you have a Facebook account, there are a tremendous number of Facebook groups with particular medical conditions that put you right into a community about talking with others about, this is a condition that I have rheumatoid arthritis. Are there others out there? And then they can pinpoint, well, this is what's working for me. This is what my doctor has recommended. Here's an article on it. Here's a community resource or an area, within our particular community that works with this. So much more so than years ago, what was available out there. So social media, I would recommend looking into it, again, with caution. Talking about your condition with family and friends. Many times others do not understand what it's like to suffer from chronic pain. And so you need to make them aware of how you're feeling, when you have energy, when you're depleted, how they can help you. Many times family and friends want to help, but they don't know what to do. Ask. It's very important that you put your requests out there. And also participating in work, volunteer, or social activities. These can also mitigate the effects of chronic pain by just taking the focus off of your pain and off of yourself. Next slide, please. So I'm going to talk a little bit here about the risks of taking opioid pain medications. Now, just to let you know, there are some people that absolutely depend on opioid medications and have to take them for, like, say, a severe injury that the pain is so intense that they can't tolerate it. But this is generally the exception to the rule. Most conditions can be managed without taking opioid pain medications. These are some of the risks involved. They should never be taken with alcohol, sedatives, or other medicines. Taking them in higher doses than what's prescribed is not at all advisable, can lead to overdose and lead to addiction. And taking them in a different manner than how they were meant to be taken, either crushed or a different point of entry, is not advisable. These are very powerful drugs, and they should be managed by your healthcare provider. You can become addicted to opioids in as little as 7 days, so 7 to 10 days. So these should be taken with caution. Next
just
one.
to add something, Barbara.
Oh, sure.
Yeah,
I'm sorry. Let me introduce Ruth. Ruth Del Pino is my associate, and I'm so sorry I didn't introduce her
totally
sooner.
Fine.
But take it away, Ruth.
So I actually have some experience talking to a lot of parents, especially when they're interacting with, any sort of substance use disorder with their children. There was a lot of co-concurring disorders. So, for example, some people had anxiety and they had to take medicine for it. Some people had depression, things like that. This is sort of the mental health disorders that I deal with when we're talking about any sort of co-concurrent substance use disorders. Now, what they had found was that especially when you're first starting on a new doctor, because I know that especially when you have a mental health disorder, it can be difficult to find a doctor that really gives you the treatment you need, finding the right medicine, regimen for your disorder, things like that. So to be sure that you're actually translating information over, because they were talking to a psychiatrist, but that psychiatrist actually had switched over to another plan, and they weren't able to give out the information right away to the physician. So the physician prescribed something else, and then there was a reaction between the two medicines. So just being extra careful when doctors are prescribing medication back and forth. And to also understand that because our bodies are different at metabolic rates throughout our formative lives, obviously something that happens to a 13-year-old could be a very different reaction to something happening to a 30-year-old versus an 80-year-old. So to also understand that our bodies may have interacted with medicine one way when we were younger, it's definitely going to be different when we're older. And that's just the reality of it, whether or not our hormones are different, all these metabolic processes that also need to be taken into account.
Really good points. Thank you, Ruth. That's true. As we get older, we metabolize drugs differently and more slowly. And so an assessment should be continual with your doctor to find out how your body is actually working. Next slide, please. So this is just probably information that all of you know already, but it never hurts to go over it. As we get older, sometimes we see many different healthcare providers. I know I have at least 3. So it's important to inform all of them of any medications and dosages that you take. I keep a little list with me. It's like a wallet size, like trifold thing. And I write down all of my medications. I keep it in my wallet. So when my healthcare provider or nurse practitioner, someone says, "What are you taking currently?" Because I can't remember everything I'm taking currently, I take out my little list, show it to them, and then they're all up to date on what's going on with my body right now. So the medication list, I highly recommend that you take that with you, keep it in your wallet, keep it somewhere that's easily accessible. Also know why you're taking each medication and how to take it. Sometimes, we've been taking a particular drug, let's say, for a number of years, and, is just added on. I know I take 5 different medications a day. And from time to time, it might be, it is a good idea to talk with your doctor and say, I've been on this medication for 15 years. Do I still need it? Maybe you've lost weight, maybe you've gained weight, maybe something's changed in your condition. I know when I lost about 20 pounds, my doctor had said to me, we can cut 3 of your medications in half because you don't need that same dosage anymore. So always talk to your doctor about, do you really need, all of these medications? And then it's great if you can journal or write down in a little book somewhere the effects of each medication, or if you're not taking it as prescribed. If you're taking it with, let's say, another drug or alcohol or something, make sure that you let your healthcare provider know that, because they need all of that information and to be able to help you. So, and if you're on a new medication, definitely write down how it's affecting you. I know certainly with antidepressants and so forth, it's very important to write down the effects that you're feeling. Okay, next slide. So this is a campaign from Partnership for a Drug-Free New Jersey that was very effective, and it's still going on right now. That it actually, the caption next to this was, "Who knew that grandma was a drug pusher?" Because at the time, in the beginning of the opioid epidemic, and actually still to this day, young people said that they started taking opioids by raiding their parents' and grandparents' medicine cabinets without them noticing that drugs were going. So this is, we need to stop this access and availability to young people to protect them. So these are the safe medicine practices that are highly recommended. Make sure that you know how many pills and a medication that you have. secure them, secure your medicine chest or put them in a medicine lock box. I have a medicine lock bag that I keep, and keep them in a location that's not easily found by maybe someone who has access to your house. You know, it's not only children and grandchildren, but it could be anyone who has access to your apartment or your home. Your cable TV provider, they're going to come and fix the TV, or a cleaning service, or someone coming in checking your meter. If they say, can I just use your bathroom? And your medicines are not locked up, well, guess what? They have very easy access to get to those medications. Also, safely dispose of all of your old, unwanted, expired medicines by not flushing them down the toilet. The best way that you can do that is there's a medicine drop box, medication drop box in just about every police headquarters in every town now in New Jersey. You can bring them there and safely dispose of them right there. I highly recommend you take off any identifying information or block it out. But you can put them in this, it almost looks like a mailbox, and you can put them in there, and they're incinerated, and they're not put into our water supply, and they're taken out of the kind of pipeline of someone accessing them. If you don't have access to set a safety medicine drop box, and you need to dispose of them from home, you can also take them, put them in a Ziploc bag with kitty litter or garbage or eggshells, or just even Elmer's glue. I've heard some people do that. They put it in a bag, you put Elmer's glue in there, smush it around, anything to make it unappetizing, and then seal it up, put it in the garbage. And that's another way. But the most efficient and environmentally friendly way is to bring them to your local police station, have them incinerated. Take your medicine. So go ahead, Ruth.
I also know that the council gives a lot of stuff away to help manage your medicine. We do that a lot. We have some of those giveaways, as well as the medicine drop box locations. We have a website for that, so I can put that in the resources when we download this video.
Thank you. That would be terrific. Yes, we do have those medicine disposal bags. We also have what we call deterra drug deactivation bags. These are, I forgot to mention those, and those are also available in pharmacies where you can dispose of these drugs, and again, in an environmentally friendly way, where you put them in, it's with a carbon deactivation chemical, sealed up. You put a little water in there, you seal it up, throw it in the garbage, and the whole thing disintegrates. It actually deactivates the drug. We have those deterra drug bags as well. And at the end, when I give you my contact information, you can always email me and ask how you can get one of those deactivation bags. And also, if you have grandchildren and your children, talk to them about the dangers of prescription drug abuse. They are listening. It will register somewhere in their brain. And I believe strongly that parents are still the most important influence in a child's life, grandparents as well. And they need to be made aware that these are not safe drugs. Just because they're legal doesn't mean that they're safe. Next one. So now we're going to get back to managing your pain. Which approach is right for you? Okay, so there are many integrative or alternative therapies. Now, again, before you try any of these, I highly recommend, talking to your healthcare provider about these therapies, just to see if that person, if he or she thinks that that's the right method for you to go too. Acupuncture, there's strong evidence for positive pain management with this approach. These are hair-thin needles. Pressure and heat in the needles is thought to correct imbalances in the body's flow of energy. They can ease pain by affecting the neurotransmitters, the hormone levels, and the immune system. So the NIH, the National Institute of Health, studies there have shown that acupuncture has worked well with managing chronic pain. It also may reduce the severity of migraines, which is interesting. It inactivates pain by modifying endorphin levels. It stimulates the endogenous opioid system in the brain. So now some people have tried it. It's worked wonders for them. Others have tried it and said, absolutely did nothing for me. So if you want to try this, again, you want to be open to it. Again, just check with your doctor beforehand. I tried it once, it did nothing for me. So, but maybe then again, I should have tried it more often, but I also didn't like the feeling of the needles, even though they say there's really no pain associated with it. Needles is not something I like to have. Chiropractic care. Now, again, some people swear by this, that the chiropractic manipulation helps, again, with blockages and helps their pain management. Others think it's absolute, doesn't work. I know several friends of mine who have chronic pain from automobile accidents. One friend in particular, she takes injections and nerve blocks, which helps for a certain amount of time. And so that's an alternative as well. For others, if your pain is triggered again by those negative emotions or feelings of anxiety or depression, cognitive behavioral therapy can also, talk therapy can help someone to mitigate the intensity of the pain by helping them to understand maybe there's something else going on besides the pain itself. Manual and other physical therapies, there's such a variety out there you can check into. Meditation and relaxation, I tell you, just slowing down, being mindful, concentrating on breath, although that's a little further down. Breathing techniques. Most of us don't know how to breathe effectively. We tend to breathe in the upper portion, our chest area, rather than the abdominal breathing, which produces a sense of calm and helps to lessen anxiety. There are, by the way, YouTube, another fabulous resource if you want to, research breathing techniques or yoga or so forth, to take a look on some of the YouTube videos on there. It's amazing. Reiki is another one. Pranic healing is another one. Guided imagery will help build new nerve paths in the brain. So, all of these things should be looked at. Nutrition. I just wanted to talk a little bit about nutrition and weight management. Anti-inflammatory diets can be really effective in managing pain. Inflammation is the buildup of toxins in the body, which can lead to chronic diseases and pain. And sugar and refined carbohydrates promote inflammation. So that's why they say, a diet high in sugar or carbohydrates actually will not help with your pain. But a diet high in vegetables, fruits, vegetables, can help shut down the inflammation. So here's just a few rules of thumb with nutrition. Eat a rainbow, 8 or 9 servings of vegetables and fruit each day. Half your plate should be vegetables. Cruciferous vegetables are the best, like broccoli, cauliflower, Brussels sprouts, cabbage. Okay. Consume limited amounts of dairy and wheat. And if you do eat wheat, it should be whole grain like buckwheat, barley, oats, quinoa, rye. Also, they say to avoid red meat, only consume it on special occasions. I know we've heard that over, a number of years now, that red meat is not as good for us as we once thought it was. When I was growing up, steak and potatoes was the meal that the go-to meal. Also consume virgin olive oils, foods that are rich in omega-3 fatty acids and B12, B vitamins like cold water fish, walnuts, chia seeds, flax seeds. You can add some walnuts to a salad for extra benefits. Now, soy and soy products for pain management may be based on gender. Some studies see soy benefits in males, but not necessarily in females. So also in nutrition, I just wanted to mention a few things, spices that promote healing. Turmeric is noted for its anti-inflammatory properties. Other spices that are known to be helpful in reducing inflammation: cinnamon, licorice, nutmeg, and ginger. So those are just a few things, in my research when I was looking it up. Those were some methods, some alternatives. Just want to see if there's anything here. Now, some people ask also, here's another one, Boswellia. It's a pain relieving anti-inflammatory, and curcumin. And these are things, again, talk to your doctor first before adding them to your diet. They may have contraindications to any any medications you might be taking, such as, like a person who's taking, oh, now I forget what it is, what the condition is, should not be eating grapefruits. All right, I'll come back to that. Can you move on to the next slide, please? We talked a bit about this already, using your mind to manage pain and other symptoms. Developing your skills in learning how to relax. There are so many relaxation techniques, again, with the guided imagery, to help you relax certain areas of the body, starting with the toes and moving up to the calves and the thighs, and just concentrating or being mindful of each part of the body and intending to relax it. Distracting yourself from your pain. For some people, watching TV, reading a book, knitting, crocheting, doing gardening, anything to divert the attention away from the pain, because the mind has trouble focusing on more than one thing at once. So if you can distract the brain, you can get some relief. Positive thinking, self-talk, making little notes to yourself, sticking them on the mirror. You can do this. You can get through this. You can help, calling a friend. For some people, they absolutely feel, if they didn't have prayer and spirituality, they wouldn't be able to get through their pain. That's another conduit. Mindfulness, nature therapy, just going outside, sitting under a tree, looking up at the sky. Practicing gratitude. They have done studies on this. It's phenomenal. Just thanking your higher power, however that manifests itself with you. Practicing gratitude, being kind to others, compiling a list of your strengths. These are all things that at least one can try. Journaling, right away the stress. Can you think of anything else, Ruth, or just that's pretty?
So my mom suffers from chronic pain, and
Okay.
she's getting a little older, so her back's not really great. And honestly, she's such a powerhouse. She moves around a lot. She has a lot of energy. And I've always asked, what is what's the thing that keeps you going? Like what's the reality that you have to face every day? And like, how do you get into the mindset of moving around? And one of her things was actually, I love being around children. She said, I love being around children. It's just the best thing in the world. So she loves being around my nieces who are about 10 and 13, and doing things with them just distracts from her pain, but also that it's just a time for her to be in the present moment. So if you're surrounded by loved ones, I think that's a really good way to sort of mitigate a lot of those negative thoughts. So she always said that's how it works for her. I also think that if there's anything else to add to this, really understanding your body, giving yourself limits. I also think it's important to say you don't have to push through every day. That sometimes like life is terrible sometimes, and that's okay. And you have those days, you have a write-off day, and then you make the next day better. So also allowing yourself some grace and being kind to your body in the process is a really important part of that too.
That's so true. Thank you. You're right. There are some days with my rheumatoid arthritis that I can do things and other days I can't. And I have to accept that. I have to understand, that there are limits now, but it doesn't mean, that I can't do something else, or that I won't be able to regain that another day. Okay, next one. So this is important. I wanted to help you to think about, you know, sometimes, I go into a store, let's say, and I see some of these free papers that are in the grocery store, Natural Awakenings or any of these things. And I pick it up and I look at it and it says, oh, here's the best approach for managing, your stomach pain or something like this. Stop eating all of this, stop taking any medication and just eat grapefruit for the next 2 weeks. And, you have to think to yourself beforehand, where are you learning? When you see a new treatment modality or type of treatment, think about first, where am I learning about this? The people who got better, okay, if they got better, were they like me? Were they an older adult, or were they a much younger person? Did they live in a different part of the country where the climate is much warmer or colder? So find out, again, who the people were that got better, or were they just the people that were friends of the person who's trying to promote this treatment method? Is there anything else that could have caused these positive changes in this person? Just kind of think it through. Could they have again moved to a warmer climate and now their joints are working better, or they're not feeling as depressed because they have the natural sunlight, which is much more prevalent in this area. So think these things through. Also, be very cautious if a treatment that you're reading about suggests stopping your medications or stopping the treatments that you are currently using, because that is not safe. Okay. You have to be, that big red flag should go up if that's the case. And it doesn't say don't eat certain foods. Like I said before, there for a long time there was something like called the grapefruit diet. Just eat grapefruit, nothing else for 2 weeks, and see how much weight you can lose and all this. And these are not safe or healthy approaches. Also, when thinking it through, can you think to yourself of any possible dangers or harm to yourself by following these protocols? Can I afford it? Now, that's another thing. Some of these are very, very expensive treatments. Is it something you're willing to spend that amount of money on, and then find out it doesn't work for you? Why are they charging that amount of money? What is it, because it really is a reputable approach and they spend a lot of money developing it, or is it someone who just wants to make a quick buck? And are you willing to go to the trouble or to the expense? So these are all questions you really need to ask yourself. Again, run it past your healthcare provider. See what his or her opinion is on it. If you still feel strongly that you would like to try this approach, maybe go to another healthcare provider, ask their opinion on it. Really do your research. We have to be informed consumers, and we don't want to do any harm to ourselves. By the way, I just wanted, well, I mentioned it, hold on one second. There's a couple of books if you have a chronic health condition or chronic pain. One of them that I really like is Living a Healthy Life with Chronic Pain. I don't know if you can see that, but it's available on Amazon. It's by Bull Publishing. And there's a new edition that just came out this year. It's put together by 4 or 5, actually 7 or 8 doctors. It's really phenomenal. Living a Healthy Life with Chronic Pain. The other one I recommend is Living a Healthy Life with Chronic Conditions. Same publisher, Bull Publishing. Okay, but this one focuses on particular conditions that you might have and suggested therapies with research articles, information. Both of these books I have found extremely valuable. So you can get them both on Amazon, or actually if you go to Bull Publishing, www.bullpub.com. They'll come up in there. Okay, you can go on to the next slide, please. So I had just put together these were some of the pain resources on the web that I found, both in the books that I was talking about, also just doing some research. Canadian Pain Coalition and Society, they had some really interesting articles on there. Usually if you go to a site and you know, and it ends in edu or .org, or you know, one of these, it's going to be more reputable than maybe another site. But the Arthritis Foundation, great information on there as well. American Pain Society. So these are all resources that you can look into. And next slide. So these are just some questions. If anybody has any questions, you can either type them in the chat or unmute yourself. If you want to ask some questions. Again, I'm not a healthcare provider, but if you'd like, I can talk to you, or we can talk to you about this. Okay, nobody, anybody? No. Okay,
I sort of had a question.
Sure.
So obviously I don't deal with chronic pain the same way other people who are older may feel it. But for example, like would these resources still be good for anyone that deals with chronic pain regardless of their age?
Yes. These are not just for older adults.
Okay.
This information is for anyone who deals with chronic pain.
Okay.
So on the next slide, it just gives you my contact information, I believe. Mm-hmm. Yeah, there I am. If you have a specific question or you want to find out any more about our resources at Mercer Council, we talked about the medicine lock bags and the Deterra drug deactivation bags. If you want to email me and gain access to those, just let me know. I want to thank you all for being here today on behalf of myself and my colleague, Ruth. Say goodbye, Ruth. And I wish you good health, and I wish you a way to help manage your chronic pain that works for you. Thank you.
Thank you.